Hello, Dr. Virginia Ellis over here today. We are going to talk about root canals. Oh my gosh, it's a root canal. They're so painful. Oh. Yes, they can be, but usually they're not. And I'm going to tell you how to avoid pain, okay, and to have the best experience possible. Okay, here we go. Before I get started, you know what to do. Put a like on that like button and subscribe to the channel and share this video because it will be very helpful. Okay, Dr. Ellis, what is a root canal treatment? Well, a root canal treatment is, mind me over here, is when you have a tooth that has an infection or is cracked or damaged and the nerve is dead or very inflamed to the point where it's not going to heal, and you're going to need to go in and clean the tooth out. So here is, I have this little model here. Hope you can see it right there. And here there's an infection of a tooth cavity that went into the nerve. It's black over here. And once that happens, the bacteria goes all the way down to the ends of the roots, and then you get an abscess, okay? So that is when a root canal would be recommended. Or when you have a cracked tooth, sometimes people come in with a crack, oh, my tooth really hurts, or they break off the tooth. But when a tooth has a crack, let me see over here, if I can you guys see how it kind of goes? Yeah, over here, it goes into the nerve. We won't see that. Sometimes you'll get certain symptoms that will know that are the sign of a cracked tooth, that where the crack has reached the nerve, and there's an irreversible, non-healing inflammation of the tooth. When that happens, you have to go have a root canal. The specialist called an endodontist, endo inside of the tooth, because they work on the inside of the tooth. Their job is to try to save the tooth. Excuse me a second. Okay, so what they'll do is they'll make like a little hole, okay, a lot smaller than this, okay? They'll get access into the roots, and then the pink stuff or the infected stuff over here, or the inflamed stuff over here will be taken out. They'll clean it, they'll shape it, they'll disinfect it, and it'll be empty like this, and then it'll be retrofilled, okay, with something called gutta percha. Once that's done, you're going to need a crown, and I'm going to explain why. In a lot of cases, you will need a crown on back teeth. Okay, can a root canal save a cracked tooth? Yes, it can, for the reason I just stated. If a tooth is cracked, and this is like, if a tooth is cracked over here, what will happen is a root canal will be done, and then we'll put a crown in there, and then the tooth will be saved. The next question is, when is it too late for a root canal? Well, when the infection has spread. So if you come in and you're running a high temperature, the infection has spread to the rest of your body, because sometimes if you let things go, the infection that spreads, that starts in here and then spreads here, sometimes can start to spread down here into the rest of your body. The source of the infection, which would be the tooth, would have to go. That's when you have to take it out, and there's no choice, okay? You got to take it out right away. Will I need a dental crown after a root canal? The answer is yes, on back molars. Depending on your situation, on front teeth, sometimes you do, a lot of times you don't. It's just case by case, okay? But if it's a back molar or premolar, I'm going to show you what I mean in this implant case model. If it's a back molar or a premolar, you'll always need a crown after, okay? So on front teeth, not always, but on back teeth, you do. The next question, what type of anesthesia will be used during root canal procedure? It just depends on your needs and how badly you're infected. So if it's like a normal root canal, you just local anesthesia should be enough, okay? And especially if you go to a root canal specialist and endodontist, they really know how to know, because they get people who are really infected. If your infection is so bad that the shots are not going to work, then you'll have to go under IV in combination with the shots, okay? So they'll do IV, like oral sedation, pills, or IV intravenous. Sometimes nitrous will be enough, but if it's really infected, sometimes you have to go under general anesthesia, okay? So it just depends on the type of infection that you have, okay? And that's something you can talk to the doctor and different fees for that. How safe is a root canal? It's pretty safe, okay? Especially when it's done by a well-trained doctor, okay? Generally safe for damaged teeth or for infected teeth. How do I prepare for a root canal? Well, you basically go to the office, go to the consultation, and listen to the doctor and follow the directions, especially after they're done, okay? So mentally, just tell them, make sure, this is really important. You have to go and tell them, if you have a fear of dentistry, if you don't numb well, if you're taking drugs and you don't want to tell the doctor, you have got to tell us, okay? Because we need to make sure that we treat you safely. If you're just had a lot of cocaine, if you're taking Xanax, if you're doing weed, we have to know. That's how you can prepare for a root canal. Be honest about your medical conditions, the medicines that you're taking, the drugs that you're using, and also how your emotions are towards dentistry. If you have anxiety or if we're working on you and something is not making you feel comfortable, raise your hand, communicate with the staff. Our assistants are here to help you. They're like our second set of eyes. We're like busy working on your mouth. Sometimes they see, your body language, or you just have patients that raise their hand and, okay, let's make this better for you. We can make dentistry comfortable for you. You just have to communicate with us. You have to tell us what your concerns are, what you're scared of, what you don't like, because we can accommodate more often than not so that your experience can be tolerable and positive, okay? So the next question is, how will I feel after a root canal? Generally, you're pretty good. You'll be tender. Sometimes you have a tenderness. Less often than that, sometimes people will be tender for a couple of months, but that's not very common. But you will be tender right after, okay? The one thing I would say is, if you have a root canal and you're going to go on a flight right away, like the same day, you will have some pain when you're going up, okay? I live in the San Francisco Bay Area, and when people have a root canal and they go to Tahoe right away, they don't get pain because there's pressure. When you're up in the air, up in higher altitudes, everything expands, and because your bone doesn't really expand like, your tissue does, you create pressure and it would create pain. It's not unbearable, but just something to know, okay? So if you have a root canal, try not to go on a flight right away. And if you are, just know that you'll probably be in a bit of pain because of, the expansion of the pressure up, decreased pressure up over there. Will my tooth be sensitive after a root canal? Yes, as I said, it's normal. It's tolerable most of the time, okay? How long does it take to recover from a root canal? Well, it could be between a few days or a week. Sometimes most people are fine the next day. It's usually when you have a really complicated case. And then again, if you find that you're in a lot of discomfort, something's off, it's not comfortable, give the offices a call. Give our office a call. Give the canal root specialist a call. Just call us and we'll guide you through the process to make sure that you're comfortable, okay? Root canal versus dental implants. What are the pros and cons of each? Well, you know what? I tell my patients, anytime you can save your actual tooth, try to save your tooth. Providing that when saving your tooth, you're still going to have function and use, right? So even if you take out, implants are great, but nothing is as good as your real teeth. Let's just face it. No doctor can tell you that fake knee is better than a natural knee that's working fine, okay? There's no way. So implants are great. They're definitely don't replace your natural teeth better. Can they be just as good? Almost, okay? I'm gonna just tell you, there's no ligament in implants. So when I'm talking about here, this pink stuff over here, okay? That's called a ligament. That's like a shock absorber on a mountain bike. It allows you to feel sensation, it absorbs stuff. Implants don't have that, okay? So the feel for that is different. It's not like, oh my gosh, it's unbearable, it's so different. No, it's not, but it's just not the same, right? Anytime you can keep your teeth, try to keep your teeth. And also over the years, even though if you have like really good hygiene, you do lose a little bit of bone through the years. That does lower the bone level in an implant, right? And also it can happen in natural teeth, but it's more in the implants. Also, the one thing that no one or hardly anyone talks about is when you have an implant, if you for example, if you put an implant on a younger person or a middle-aged person and they have, say, like an implant at the front tooth, what'll happen a lot of times over the decades, 10, 20, 30 years, is that implant tooth will start to look shorter than the other teeth. And it's because over the decades, we change, right? Our skeletal shape changes, our height changes, everything changes. So what happens is also the position of the teeth changes and they start to move, right? But the implant doesn't change. So at some point you wind up having to redo the crown to kind of make up for the drift of the other teeth. So the implant doesn't drift, the other teeth do. And it's a natural process, but it's just something to keep in mind, okay? That's another reason why I try to hold on to my natural tooth, okay? Anytime you can, what Mother Nature gave you is the best deal, okay? The best thing to keep. Why are dental crowns recommended after a root canal? Okay, the reason for that is because on back molars, you do need, and premolars. So going back over here, molars, premolars, whenever you have a root canal done, you have got to have a crown. And the reason for that is because when you have a root canal, they remove the pulp. And in the pulp, you also have like the little micro arteries, the little micro veins that give hydration to the tooth and nourishment. That's gone. So teeth that have root canals, molars get very brittle. The molars and the premolars take a lot of biting and chewing forces. So what happens almost always, if you don't put a crown in there, the tooth eventually breaks and you lose the entire tooth, okay? And an implant is, I would say in the Bay Area, is about $7,000, a little over $7,000, okay? So much cheaper and healthier and better to put a crown in a tooth that is naturally yours. How much does a root canal treatment cost? It just depends. Generally speaking, front teeth are cheaper than back teeth. The reason why back teeth are more, it's because there are more canals. You know, you have more roots. You have multiple roots, and the front teeth don't usually have multiple roots. Also, it depends on where you're living and whether you're going to the specialist or the general dentist. Everyone has their own prices. But if you're living, say, like I've said before, in Louisiana, Alabama, Texas, as opposed to California, San Francisco, you know, California and San Francisco are obviously going to be a lot more. It just depends on the cost of living of where you're getting the service done. And also, you know, who's doing it. Just go to whoever you know is going to do it the best, okay? Best thing to do is give our office a call or give a dentist who will give you the honest truth. It's like, you know, go here. If the general dentist feels comfortable enough and has had a lot of experience doing root canals, you could do that. But I personally do like having a specialist do it, unless the general dentist has had a lot of experience. And that's something you can ask the general dentist. The endodontist, they're really well equipped, okay? Or if they have an endodontist coming in, they have the huge microscopes. If there's a complication and one of the instruments breaks on the tooth, they know exactly what to do. Kind of like an oral surgeon, you know? There's a complication, they know how to take those teeth out pretty quickly because that's all they do all day long. So that is my own personal take on that. Unless you are going to a general dentist that has a lot of practice and is very comfortable treating multiple cases and complications. If you found this information helpful, and I hope that you did, I think you did, put a click on the like button, subscribe to the channel, and share this video with others you love. All right, I'll see you at your next video, and keep on smiling. All right, bye-bye.